Okay. Hopefully you can see my screen. So again, any information that I use, you are more than welcome to have. Just remind me at the end. I certainly do not mind. And whatever you're studying, wherever you're studying from, the information should be the same. You shouldn't be finding different information in different sources. So whether you're using Helwig, and Helwig is what I'm using today, that is the one who does your pocket prep, that's Helwig. So whether you use him or whether you're using Rosenthal or the Green Book, whatever you're using, the information should be the same. What I really try to do is make sure that the information is understandable. I think that's the issue sometimes. A lot of my students will memorize what they're supposed to memorize, but really don't understand what the question is. So again, I am using this one. If you've used Pocket Prep, it'll tell you, let me show you. So if you use Pocket Prep, and I'm not recommending that you use Pocket Prep. I'm not saying that. I'm just saying if you use it, when you answer the questions, it'll always tell you where it comes from. And if you're studying, if you're going to follow along with my study group, then you're going to check, you're only going to study one thing at a time. It's so overwhelming. There's so many names and so much information. So we're only going to really focus on one thing at a time. Okay. So then if you look at treatment planning and then you start there, what you'll find is those questions come from, and I'm just going to there. Oops. Just wanted to. Okay. So when it says Helwig, that tells you where it comes from. So if you have this, then you can go back to Helwig, which is the book I'm using today, and you can definitely then go in and look at those answers. Okay. Let me just I'll do a couple of these. Okay. Just so you know what it looks like. Anyone who, does everyone use it? I'm assuming that everyone does. Is that a correct assumption? Open your chat box or you can just speak. Everyone use it? Yeah, most people use it. So I don't normally use it in the study session just because some people already have it. But so in general, this is a question that we're looking at. So in rational emotive behavior therapy, what does the ABCDE mean? So in rational emotive therapy, which is REBT, that is by, anybody know who that's by? That is by Albert Ellis. And what he said was that we have irrational thoughts, irrational beliefs. And if we can then correct those irrational beliefs, then we won't be stuck in that process again. So what the ABCD part of that says is A is my activating event. So something happens, activating event. I tried to do something and it failed. My belief, I must always be successful, which is irrational because who can always be successful? The consequences of my believing are I feel bad, depressed. The dispute the irrational belief. That's what I thought in B. It can't be true. I'm going to dispute that process. And E gives me new thinking. So that's what it looks like. Okay. So then my activating event, let's say that I was happily married and I thought things were great and my husband divorced me. So that happened. Those things are not disputable. That happened. However, when it comes to my thought process regarding that, that's what I can change. So my current belief, so he left me, my current belief is, wow, I must be like awful. I can't believe I did that. I must be like the worst person on this earth. Oh my gosh, if I were skinnier, if I were this, I were that, he would have loved me, blah, blah, blah. All that belief about the event. I mean, I'm sure many of you have been in a situation, have friends, or you've talked to clients who've had those irrational beliefs. So the consequences of my irrational beliefs for me, then if I think he left me because I'm worthless or I'm stupid or I'm fat, I'm whatever I'm thinking, then it has emotional consequences. So then I think I'm a hot mess. So now that I'm so sure that I'm the worst person on earth, when I go out to date new people, am I going to be interested in finding the doctor? Probably not, because I definitely think that, exactly. I don't think I'm worthy. I don't think I'm good enough. If I were good enough, he wouldn't have left me. Okay, so that's the whole pattern of those irrational beliefs. And I know nobody in this group does, but sometimes people have irrational beliefs that I'll never pass this test, right? Got to take this test. Irrational beliefs is I'll never pass this test. So then the emotional consequences of this, yes, the emotional consequences and that stress goes all the way up. Okay, I'll never pass this test. I'll never get all this information. So when you open your book to start studying, you've got all of these thoughts in your head. I can't get this. I can't do this. It's so very, very hard. And that's just not true. Those emotional consequences, that belief system is not true. The test is hard. I'm not going to pretend it's not. There's lots of information on there. Is it doable? Yes. Okay. Does passing this test decide whether you're a good counselor or not? Nope. Y'all all know people who have passed this test who are just rotten counselors. Those two things are not related. And I know the importance. I get the importance. So what we try to do, especially with tutoring and coaching, is really kind of change those irrational beliefs. We break it down in small chunks. You begin to kind of get, oh my, I know what that means now. I understand. And that really changes kind of how you see that. That's a dispute to your belief system. So again, the same way with that unhappily married, but the woman who got divorced. So then we change the emotional consequences. We're going to dispute that belief. Sweetie, he left you because, he's worthless and he's a narcissist and, nothing you could have ever done would have kept him. So if we change that belief system, then she has new effective beliefs. So that's what we're looking for when it talks about REBT. That does belong to Albert Ellis, irrational beliefs. Okay. So, which is a little bit different than cognitive behavior therapy, my CBT, because my CBT is my cognitions. Okay. So that talks about then changing my thought process. So, which they're, for not the test, they're not that much different. However, for the test, you'll see things about their thoughts and not their beliefs. So you're going to have faulty thinking process when it comes to CBT. Okay. And CBT then looks at, we're really going to change the way that you see things, the way you think about things, as opposed to my REBT, which will really then look at those irrational beliefs. Try to close out some windows, guys. I've been tutoring all day. And again, feel free, please, to ask any questions. All you have to do is unmute yourself. You're just on mute because background noise really sounds really loud and it's annoying to some of the other people in the room. So definitely, that's the only reason you're on mute. Okay. Someone unmuted themselves. Do you want to say something? I haven't bitten anyone in at least a week. Okay. So then, CBT, like I said, it's cognitive behavioral therapy. Okay. My thoughts that we look, how we think affects how we feel, right? Okay. So one of the things we do a lot with CBT is those affirmations. I'm a firm believer in affirmations and changing that thought process. I've raised 3 children, and all our mirrors, there are like these great little sayings. I'm beautiful. I'm amazing. I can do this. They're just kind of all around, especially the mirrors, because you get dressed in the morning and sometimes you're having a bad hair day. But to kind of see those things on the mirrors, I always thought was pretty good for my kids. So that's what it looks like in my house. One of the other things I suggest is when you're learning these theories, if you do the same thing with sticky notes, post them everywhere. Oh my goodness, if you see them every day, you're going to get so sick of it. You'll know it. You'll know it. So, thoughts, behaviors, emotions. If I change the way I think, I'll change the way I behave. I'll change the way I feel. Same girl, I'm thinking, wow, I must be old and ugly and wrinkled and nobody will ever want me if that's my thought process because I got a divorce. Then my behavior is I'm going to go out to the bar and pick up the first one that even looks at me, because that's my thought process. and then, my emotions then like, wow, I can't believe I did that because I don't, what a piece of whatever I am. And that process is going to keep continuing. So if I can change that thought process, if I can learn, I'm a great person. I'm a great person. I'm good at this. I'm good at that. With your clients, many of you would use this. And what you do is you kind of, start small, find something about yourself that you like. Okay, so that's CBT. And again, this many times actually is given to Beck. He's not the only one, but Aaron Beck, Beck's depression scale, the Beck's anxiety scale. So many times it's given to Aaron Beck, but that is CBT. So that's kind of what it looks like based on the pocket prep. So again, I'm going to be using this is the Helwig book. It's based on that. How is the intervention different with REBT as opposed to CEBT? Are they both evidence-based? Yes, they're both evidence-based. They've both been around for a very, very long time. The words you're going to look for, and that's what I'm going to teach you tonight, is what words you're going to look for to kind of key in on which theorists. So REBT is irrational thoughts. REBT is my irrational belief system. Faulty thinking is CBT. So what you're going to look for is then those words when it comes to what treatment plan. That's the trigger we're going to look for of how to decide which one it is. And yes, they've both been around a very, very long time. Anyone seen DBT on the test or in your study guides? So DBT was actually first started to use with anybody know?
Is it substance? A lot of substances use DBT.
Now they do. They sure do now. Do you know where it started, though? It started with those lovely, lovely borderline personality people.
Oh, yeah. Oh, yeah.
Yes, who we know that those personality disorders are ego syntonic personality treatments. They don't come for therapy. There's nothing wrong with them. So DBT actually started with that population, and now we've used it with a lot of others. So that's where the term mindfulness comes from. Your interpersonal effectiveness. Tip for life, tip for the test. Inter, I-N-T-E-R, is always between two people. Intra, I-N-T-R-A, is with inside myself. So inter, I-N-T-E-R, between two. Intra, just in myself. So intra would be something Freudian many times. I'm using some looking at myself. Inter is among other people. That's just in life and as well as a test tip. Okay. Emotional regulation and learning how to increase my distress tolerance. That's what DBT comes from. So again, support-oriented, cognitive-based, collaborative. You have weekly sessions. So again, this is the verbiage you'll look for if it's looking for DBT. Mindfulness, interpersonal effectiveness, distress tolerance, as well as emotional regulation. So those are terms you're going to look for when we talk about DBT. And I do apologize. I've been meaning to. I try to always put this in here so kind of get where it came from. I'm not a fan of looking directions or kind of looking on the internet all the time for the test type of answers. That's probably not the best answer. However, if you know what it is already, if you're looking for an image or something to help you remember it, it's great for that. Okay, but don't always trust what the internet says about the actual information, unless you're using a definitely one of my really research-based programs. Okay. So again, I said I'm using this book. So some of our biggies are like Gestalt. Okay. So if I'm looking at Gestalt, what words would I look for? So Gestalt is my person-centered. 2 chairs or 1? So Gestalt, Alan explained to me the two chairs. You can unmute yourself. I promise it'll be okay. So I'm going to keep talking.
Sorry, my Skype app, I can't have like the chats on the side, so I have to keep like clicking back and forth. So that's why there's a with my but with the July, I know it's like that mode of therapy is trying to identify someone's needs and how to apply that, I guess, to the present. And it uses a lot of role playing and the two chairs technique.
Which
is, I guess, you pretend that the person that, or the I guess it's whatever issue you're having, you can, I guess, you pretend that the person's sitting across from you, and you work through it with the therapist, which is like the role playing.
Okay, so you're absolutely right. So go ahead, somebody else.
I was going to say, and with the role play, it helps you to bring closure.
Exactly. So some of the words I'm going to look for. Well, thank you guys. Thank you very much. So let's get some background history. So our first big therapist was, of course, Freud and all my psychoanalytic or psychodynamic people. And then after that, what came along was Carl Rogers. And Carl Rogers was my humanistic person. He looked at the words like congruence and being warm and genuine and being there with the client. He's the one who called them clients as opposed to patients, because Freud had called them patients. So now Carl Rogers came along, client-centered therapy, patient-centered therapy, Rogerian, humanistic. So that kind of changed things. So then what happened is Gestalt is by who? Anybody know? Fritz Perls. Fritz Perls at Gestalt. And what he said is, so the words you'll look for is here and now, because what he believed is we need to focus on the here and now, but we had to let go of that stuff. So that was what that was about, our unfinished business. So, and if you've had me before, you'll know one of my favorite, Dr. Phil. Dr. Phil says, pretend your mama's sitting right there and there's some things you want to say to her. So the chair technique was to really process whether the person was there or imaginary there, to kind of say what you needed to say, finish that business, and let it go. So that really is, Gestalt means wholeness. He wanted you to be whole. So what you're going to look for again is here and now. Those are the words. The empty chair technique, role playing. All of those belong to Gestalt, and that's Fritz Perls. Okay. Good job, Ellen. Thank you very much. Other questions? Anybody else want to share anything about Gestalt? Okay. I mentioned a little bit of Carl Rogers also. Client-centered, patient-centered. I'm sorry, not patient-centered. Client-centered, person-centered. Making sure that the client was the expert. So we're the role of a teacher maybe. However, not the expert. The client was the expert when Freud believed that Freud believed the therapist was the expert. And then we came along with that humanistic approach, and then we believed that the client knew what they were doing. And if we were warm and supportive, congruence means everything lined up. What I'm saying, my body language, if it's all lined up, I'm congruent, that's what my client will believe. If you know anything about kind of, how we tell people are lying, is that incongruency. So when everything doesn't line up, when my body language doesn't line up with what I'm saying, that's incongruent. Okay. So then my first question on 41 talks about, yes, open-ended questions. Yes, you got it. Helping relations. So object relations theory conceptualized 4 broad stages of development. Which of these stages is usually the third to occur? Object relations theory is Margaret Mahler's theory. And Margaret Mahler said, anybody want to tell me what she said and who she was? Okay. So she really looked at the importance of having those relationships. What she said is that if we didn't develop those relationships, that many times we would end up being, those children would end up being our conduct disorder kids. Anybody know what that means? What are my conduct disorder kids?
The ODDs.
ODD and conduct are a little bit different. So
They?
my oppositional defiant kids,
Opposite.
yeah, so those are my oppositional defiant. They are, and sometimes you'll see the behavior the same, but they're not mean. Their intent is not to hurt you. So an ODD kid will not follow rules. An ODD kid might throw a table. They really might, but their goal is not to harm you. The intent is not to be mean. My conduct disorders, they're the ones who lack of empathy, no regard for life. They hurt animals. They're the ones that will steal and hurt you. Just mean kids. They have to be diagnosed by the ages of 12 or 13. Okay. So we also know that my untreated conduct disorders many times will end up with what personality disorder?
Schizo? Is it schizo?
Nope. It's my antisocials.
Yeah.
Yes. And antisocial does not mean anti-people. My antisocials love people. They love to beat you up and eat you. Not all of them eat you, just like who's the one that ate the people? I don't know. My serial killers, my mass murderers, my really people, who ate the people? I'm trying to remember. Remember the killer that kept the people in the refrigerator?
Dharma.
Thank you. Thank you. Exactly. Okay. So yes. So he wasn't antisocial. He would invite you over. He'd kill you and eat you. So it's just an anti-people. Sometimes in lay terms, we'll see antisocial. Someone said on TV, but that does not mean that they don't like people. It means they really, really have no disregard. And what we know is my untreated conduct disorders end up with as my antisocials. With personality disorders, we know that we don't diagnose them until you're 18, but they really have had those symptoms many times since childhood. Okay. And again, so Margaret Mailer would say the problem with that is they didn't attach. That if they didn't have someone to bond with, if they didn't have a safe place to call home, they never attached. So her first stage is that normal autistic phase, and babies just lay there those first few months of life, or she would say, the first few weeks of life. Normal symbiotic, and symbiotic is, I need this relationship to survive. 3 is separation. So what she said is until stage 3, children did not know they were separate from their moms. They thought they and the moms were the same. And about stage 3, hatching, practicing rapprochement is when they realized that they were not the same as their mom. Okay, my normal autistic phase, normal symbiotic phase. Okay, hatching. So that's the question that we talked about with stage 3. So the infant starts noticing that him and his mother are not the same person. Oh my gosh, like they finally realize they're separate. Rupture of the shell, that I'm a separate person. They're really, they use their mother as a point of orientation. So what we know is the stronger that bond with the object, with your mother, with your parent, with your constant caregiver, then the more willing you are to go further and further and further. Between age 9 and 16, of course, they're beginning to crawl and walk. They'll really kind of go further than mom. They'll walk away. They'll walk between mom and dad and walk back. Like they're getting there. They're getting there. Rapprochement, of course, is then, they'll begin to go further away and come back. Approach, come back. Approach, come back. Okay, so object constancy really involves knowing that mom will always be there, or that one caregiver will always be there. So if I've been in, 12 different foster homes, or I've been in a situation where I've been with mom and grandmama and daddy and all these people, then I sometimes have that failure to bond. Okay. So again, separation, the individuation phase starts in first grade. I'm sorry, it's between the teacher and parents, all those things. Okay, so Margaret Mailer suggested that we had to bond. Okay. Questions?
She's under development.
She is one of my developmental theorists, but she's also one of my theorists. Okay, she's under developmental theorists. However, she's also one of what we'll see for treatment. Okay, so she's under. Let's see here. Here we go. So she's under helping relationships. Okay, so then number 42. In his person-centered approach to counseling, which of the following processes did Rogers feel was not necessarily or appropriate? Diagnosis, the relationship, core conditions, or client phenomenological world? Okay, let's go back to number 41. I'm sorry. So the answer to 41 occurs in what stage? So we know it's not symbiosis. It is B, the separation individuation. You got it. You got it. Okay. So 42, Carl Rogers. We talked to him about him a little bit, but Carl Rogers, he felt one of those things wasn't necessary. What was that? Exactly. He didn't live in this day and age where I needed to bill. He didn't feel it was necessary to diagnose. He felt that was unnecessary, and that just made it worse for the client. So diagnosing was something he didn't think was that important. Okay. 43. So we just kind of talked about these, and this kind of gives you an example of what we're looking for. A counselor focuses on belief systems, self-talk, and crooked thinking with her client. It is likely that this therapeutic approach to the counselor is strongly influenced by what? Okay, I'm gonna let you look at that, guys. I got to go to the front door real quick. If you want to look at 43 and 44, I'll be right back. Okay, sorry about that. So then, 43. So is that existentialism, reality therapy, solution focused, or REBT? And that is correct. It is REBT. So belief system, self-talk, crooked thinking. So had this one been CBT, if that had been one of the choices, that would have been a tough call. Because crooked thinking sometimes goes to CBT. So in this example, and most of the time, they're not going to give you both. They're going to make it really clear. They're not trying to trick you. They're not. Okay. Existentialism. What's that one, anybody? I always think, why do I exist?
The here and now or something.
Exactly. Why am I here? Okay. So existentialism really looks at why am I here? Why do I exist? Experience, the memory device of experiences. Sure, Ellen, what do you mean?
for experiences, I like to think of like existential, like how you got to where you are, like what experiences in your life have brought you to, your present state. Because
Okay.
a lot of the therapy with existential is kind of looking through those processes, looking through like how you got to where you are now, and then working through the here and now.
Okay. I tend to think that my existentialist, you'll see it's the one that's called neoclassic, the newer ones. So if you look at the top of Maslow's chart, so the people at the at top of his chart are experiencing what? So Maslow, of course, was one of my other humanistic ones. And he's at the top of his chart, you were looking at self-actualization. So I kind of think about that when I think about my existentialists, because they're really kind of the higher level thinkers. They're not on the bottom shelf where they're looking at, what am I thinking? What am I processing? How am I going to feed my kids? They're not at that level. So why do I exist? So if I'm at the bottom of Maslow's chart and I'm looking at, how do I feed my kids? I'm not really going to use existentialism, and I don't really care why I exist. Anybody remember the bucket list with those people? Who was in that movie? The bucket list. The guy was like, he had like all the money, and the other guy, the black guy, was a mechanic, and they were both in the same hospital room. Jack Nichols, and anyway, okay, before your time. But so the point of the movie is kind of the bucket list, and one of the characters is he's worked all his life, and he's paid like worked to pay the bills, and make sure his grandkids all this good stuff, and he was worried about here and now and making sure everything was done. The bottom half of Maslow, and the Jack Nicholson character, he really looked at. He enjoyed traveling, and he wanted to go to see the Dalai Lama, and he wanted to do all these amazing things. So I think of that of existentialism, like, why do I exist? So what is my purpose? So if you're in the lower level of Maslow's needs, you're looking at food, clothing, water, security, does someone love me? I'm not really figuring out why I exist. I'm just not there. But if I'm the top level, where I'm not really looking at those things, I've got enough self-esteem and confidence. If I'm at the self-actualization level, then I'm wanting to know, why do I exist? What is my purpose? Why am I here? Okay. So that's usually when I existentialism, I think of, again, why do I exist? Okay. And again. Being in the world, if a tree falls in a forest and no one is around, does it make a sound? Okay. Bottom of Maslow's hierarchy of needs, you don't really care. You wanted to know, can I make some firewood out of that tree and feed my family and make a fire? Okay. So the question, again, when you're looking at existentialism, so what you're going to look at is sometimes the words you'll look for is, why do I exist? What is my plan? What should I be doing? What is my purpose? All of those things are things you'll look for. Okay. My reality therapy, who did that one? Glasser, he sure did. So what did Glasser do? There's a question on the test or on the sample test that talks about the kid who's 17 and he's not doing well in school, and his mom and dad really don't know what to do with him. He continues to make really poor choices. And one of the questions is, which technique would you use? And with reality therapy, it really is a dose of reality, kind of looking at like, so if he's 16 and he, doesn't have any plans of what he's going to do with his life, then how's he going to figure this out? Just put that short video there in your chat box. So again, some of the words you're going to look for when it comes to reality therapy, of course, we know it's Glasser. But what I want you to know is just kind of the terms to look for. So it's also sometimes called choice therapy. You make those choices. That's up to you. You've made those choices. So it's emphasis on the responsibility. The therapist's function is to keep the therapy focused on the present, and talking about what we do as a client, how the client can make sure that they're meeting their own needs. They make choices in life. If you want this, you're responsible for it. To fulfill one's needs in such a way as to not deprive another of their ability to fulfill their own needs. It focuses on their total behavior, your acting, thinking, and feeling, and your physiological. Okay. So again, what you're going to look for is choice therapy. A client is making some bad choices, and what reality therapy too was kind of look at making sure that you can meet your own needs. The need to survive, the need for love and belonging, power, the need for freedom, and the need for fun. Okay. So then WDEP, we still have seen that. Your wants, what do you want to be doing? What are you doing? Where do you want to go? Your evaluation. Does your present behavior have a reasonable chance of getting you what you want? And then let's plan something different. So that's reality therapy. Those are some of the terms you're going to look for. And again, so the goal is to kind of know enough about the information on the test to kind of figure out who it can't be. So you may not know all the theorists. There's a lot of theorists, let's not pretend. But if you can figure out who it's not going to be, then that definitely would make it easier for you. So again, plan for change. It's simple, it's attainable, it's measurable, immediate, and controlled. All of our objective goals, especially when looking at a behavioral approach, have to be measurable. Okay? So that is my reality therapy. Okay, and again, I'm putting in the chat box, you'll see all of the links that I used today, as well as the video will be there at the end of the session. I'll close some windows because I have a lot open. Just kind of throw in that. So Maslow's hierarchy of needs, he is my humanist. Something that made his theory unique at the time is there was nothing around that even talked about wondering how we were doing in life or making sure my needs were met first. That was such a foreign concept at the time. So it was highly controversial when it came out of like doing those. And just, there's actually another level. Does anybody know what it's called? It's transcendence. That's their top level there, actually. Transcendence. Maslow believes that you could go up and down the scale. You weren't always there. He also believed that very, very few people actually made it to the top. And Maslow actually didn't do the last schedule. It was done by someone else later. But it's a motivational theory. The theory is that we all want those things to the top, and then how do we get there? We're motivated to kind of get there just to the top. So I remind you of that because it matches with Rowe's theory. So Rowe was a follower of Maslow, and Rowe, when it comes to career development, she was a follower of Maslow. And what she did is she kind of focused her theory of career development on Maslow. So it's the motivation to kind of keep going up. So then the same thing, what she said in her theory with your career was depending on what you didn't get as a child, if your parents weren't warm, they weren't caring, they didn't do any of those things, then that's what you're looking for in your career. So she based her theory on what Maslow believed. And again, he believed very, very few people got here and even less people got there. And it's also, when you're there, it doesn't necessarily stay. That was Ann Rowe. Pull her up for you. She's one of my career people. Okay. And what she said was that your career is based on the Maslow's hierarchy of needs. That what you were missing is what you focus your career on, and it was called levels, fields, and levels. So what she said is there's several groups, and depending on how your parents raised you, that gave you your field and then your level. So that's what that looks like. Okay, so what she said then was based on, again, so your parents' parenting skills. So if they were overprotective or over demanding and warm or cold, that really decided what you were looking for in your career. So maybe you were looking at a career that was more towards a major orientation towards your person, yourself, maybe others, but that was based on Maslow, the same kind of thing. It's a motivational theory. So my parents didn't give me what I needed growing up, so I'm motivated to go out and feel that need myself. Okay, so again, that's just a reminder that it's a motivational theory, that the goal is all of us want to get to the top of the level, but most of us don't, according to according to Maslow. Okay, solution-focused therapy has my miracle question. What does that mean? Someone's typing. Solution-focused therapy is the only therapy that doesn't use the medical model. So most often we use the medical problem. We start with the problem first. Solution-focused therapy does not. It starts with the solution focus first. And sometimes it's solution-focused brief therapy, SFBT, solution-focused brief therapy. But that miracle question is, if you woke up tomorrow and the miracle had happened, what did it look like? Exactly. Thank you, Melinda. Great job. You did great. So it really was. So, and again, it looks at, this therapist, the only one, and you'll send the question, which one doesn't follow the medical model? Because the medical model says you walk into the doctor, and the doctor says, what's wrong, right? And what the miracle question says is, we don't start with what's wrong. We kind of start with what's going on right. So then what we're going to do is then, if it worked tomorrow, if we wake up tomorrow and everything was fine, what would it look like? Stephen DeSager is the one who most often is known for this one. You get a commercial there. Okay. Okay. Again, the miracle question, scaling, and client goals. Scaling is on a scale from 1 to 10, how's the problem today? Okay. Or, compared to how it was yesterday, what's it like today? That's my solution-focused, and again, my solution-focused brief therapy. Even with typical solution focus, it's not a long-term therapy, so it's a brief therapy in general. But Stephen DeSager is the one who most often gets credit for that. Okay. So then, number 44, a counselor who believes that the people's behavior is best explained as reaction to stimuli in their environment is probably working from what theoretical perspective? Oh, yes, you're correct, Miriam. Going to give me more on that? Would this be Skinner or would this be Pavlov? Be brave. Unmute yourself. Okay. So then, stimuli, I'm thinking.
I think it's Pavlov.
Thank you. That's Pavlov. because I'm thinking of stimuli, my reaction to the stimuli. So that's my unconditioned response or my conditioned response. Exactly. My two behaviors, my big ones, Pavlov and Skinner. Pavlov, of course, was known for that dog and that classical conditioning. Okay. So what we know about classical conditioning in general is that you can be brave, Miriam. I promise you. I will just gently say, that's not quite correct. Okay. So in general, what it looks at our conditioned responses. So then he looked at our unconditioned responses are our body, things that my body would do that I oftentimes don't have a lot of control over. And he was trying to pair that with something that he could control. So an unconditioned response is so none of you, I'm sure, but if you see an attractive man, your heart might skip a beat, or you're looking, take a second look. Because Pavlov would say, that's an unconditioned response. That's what my body does. It's not a plan. It just does. So the dog brings food. There's food coming. The dog salivates. Like, oh, it's panting. I want to eat. I want to eat. I want to eat. I may pant a couple of times too when I want to eat. I want to eat. But that was just kind of a natural biological response. So what he wanted to do was then he wanted to pair that unconditioned response with an unconditioned stimuli, which was the food. When you pair them, they become conditioned. Okay, the neutral stimuli was the bell. And of course, so then he conditioned those together. And that's kind of what that looks like. So stimuli was the key. Behavior. The other one is Skinner, and Skinner did my operant conditioning, and that's my reinforcement and my punishment. But in general, so then Pavlov said that, hey, you know what, this unconditioned response, that dog is going to, his mouth is going to water, the food's going to be there, he's so excited, can't wait. The bell didn't mean anything. You ring the bell, meant nothing. So then what he wanted to do is he wanted to pair that with the bell. So when he rang the bell, the dog would know that food was coming. So that's what it looks like. It becomes conditioned stimuli as well as a conditioned response. And I've said this before, so many of my students have been conditioned thanks to AT&T or who else? Whatever your phone carrier provider is, you have been conditioned to that. So you probably have a certain ringtone or ring for someone else, and when that phone rings, even before you know who it is, then you have a emotional, your body has this response. It didn't, that ring didn't mean anything before, but now that you've conditioned it with that person, then now you have a response. So, I have a ringtone for all my kids. So, if I get a ring at 2:00 in the morning from my son, I'm not as worried because my son he's on the other side of the world, and they're in a different time zone. They're 12 hours behind us. So I'm not as concerned. It's my son. I hear the ring. Okay, I'm like, oh, well, he probably wants to talk to me. If it's 12:00 and my daughter who lives in the United States, or 1:00 or 2:00 a.m. and that phone rings, it's a different response. Like, whoa, what's going on? I'm terrified. And I haven't even seen who it is, but I've conditioned myself to know that ring belongs to that child, and then I have that response. So that's a typical classical conditioning, which again belongs to Pavlov. Now Skinner, this issue is the one that many of my students struggle with. That's that unconditioned, reinforcement and consequences. Anybody want to share and tell me how this works? The best way to remember it, I'm telling you, is just to share it with someone else. Come on, take a chance. Tell me what it means. Okay, so reinforcement always increases behavior, and punishment always stops the behavior. That's what we're looking for. Okay, perfect. So, Ellen, can you give me an example of a negative and an example of a positive reinforcement?
So I guess a positive reinforcement would be, I think there's a question on the pocket prep that this reminds me of, and I think it's a good example of a child who has increasingly worse tantrums, and the parents try to do all these different things to make the tantrums stop, but the tantrums just keep getting worse. So the interventions of the parents, which is like ignoring or putting the child in a bear hug, they're all positively reinforcing the behavior because the behavior keeps increasing.
Okay, because they're giving him something.
Right.
So positive is giving and negative is taking away. So you're absolutely right. Positive is always giving that something that's going to increase the behavior. So what's an example of negative reinforcement? Most often, if you've listened to the video or you've kind of heard it someplace else, I'll give you the example of the seatbelt. That, government kind of likes if you buckle your seatbelt, you get in that car, and the car is making that beep, 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 loud noise, extremely annoying. And if you buckle your seatbelt, what happens? The sound is taken away. It's a negative reinforcement. It takes away what you didn't like anyway, because that's going to reinforce your behavior. So that's what it looks like. But most of the time, it's a difficult concept to grasp. So then, can someone else give me another example of those? Taking the phone away if he doesn't do his homework, that's not reinforcement. That's punishment. Reinforcement is when I really like what he's doing and I want the behavior to continue. Okay? So then, for example, yeah, that's a consequence. That's a consequence. But I want it to continue. Let's start with the punishment. They're easier at least. So, not that I would ever really speed, but if I did speed and I'm driving down the highway and I get pulled over, and what is something the policeman could give me that would stop my behavior?
A ticket.
Bingo. That is positive punishment. He gave me something. What is something he could take away from me that would stop my behavior?
Your driving privileges.
Exactly. He could take away my driver's license. He could impound my car. He could do a lot of things. Take away, okay? All those things that would stop me from speeding. Now, reinforcement, on the other hand, is I really, really, really like what that behavior is, what's going on. And if you had me before, I often use the same example. So then, you know what? My significant other never cooks or cleans. They don't do what I ask them to do. Oh my gosh, they're just awful. But this weekend, I come home and you know what? The house is cleaned, dinner is cooked, the kids are in bed. Oh my gosh, I'm so thrilled. What could I give my significant other that would help increase that behavior? Kiss, love and affection. Take him to the bedroom, give him something. Okay? Stickers is positive reinforcement. Grounding from privileges is negative. Those are still, grounding from privileges is still a punishment. It's not a reinforcer because I want the behavior to continue. So with this last example, what I just said is positive reinforcement. My significant other, he makes dinner, he does something I'm thrilled with. She makes dinner, she does all these great things. I'm going to give her something, love and affection, anything, intimacy, give her something, okay? Negative reinforcement will be taking away something that they didn't like anyway. So if I said, wow, honey, you're amazing. You really helped me out. You washed the dishes. I know you made dinner. I'll wash the dishes. I'll take away something you didn't want to do anyway. Wow, honey, thank you so much for helping out with kids this weekend. You know what? I will wash your car this weekend. I will walk the dog this weekend. I'm taking away something they didn't want to do anyway. Okay, that's like at work. So can you imagine if you went to work on Monday and your boss said, you have done such an amazing job. This week has been great. Your cases are all lined up and everything looks wonderful. Take Friday off. I didn't want to work Friday anyway. If you take it away from me, I'm thrilled. So taking away something that the person didn't want to do anyway, you're removing something that was aversive or I just didn't want. So reinforcement, whether negative or positive, give or take, always increases the behavior. So punishment, negative or positive, decreases the behavior. So for the test, you're going to look at what the behavior is. Is it punishment? Are they wanting it to continue? They're trying to stop it. And then am I either giving something or taking away something? Okay. So go back and watch this part of the video at least, because that's a really difficult concept for a lot of my students to get, is because we're so used to thinking of anything negative as bad. And negative is just taking away something that I didn't want. Okay. That's all that is. Okay. So the answer to that one, of course, was behavioral. We've talked about solution focused. We've talked about person-centered. Who wants to be brave and tell me what transactional analysis is? What's my TA? Exactly. My TA looks at my transactions between me and the people in my life or other people. I see some people being brave enough to type. Thank you. Games. Ooh, gotta give me more than that. So TA looks at the relationship between it's a communication pattern between my different ego states. Okay. So what TA says is that, and this is Eric Byrne, and what he said is that all of us have a different ego state inside of us. There are three ego states: my parent, my child, and my parent, my adult, my child. We all three have those ego states inside of us. My parent is the one that the behavior, thoughts, and feelings copied from a parental belief. My adult is the here and now, and my child is what I want. So all of us inside of us always have those ego states inside of us. Okay. The issue is how we then begin to communicate with people when we're not always in the same ego state. There's a question you'll see, I've seen a couple times, has to do with a group session. And if I've got a group going on and they're a group of former drug users or users, which is the best therapy? And the answer to that one is TA, because what happens in drug treatment is that the assumption is that if a former addict, an addict is talking, he's lying. So he may be coming from a child state saying, oh, I didn't use. But one of the co-partners or one of the people in the group will say, hey, wait a minute, that's not true, because they're coming from their parent state. Okay. So what it really is kind of looking at the relationships, the communication between people, depending on what state you're in. So the complementary transactions, those are the ones that we're okay with. You're coming from the same level. Okay. So if I'm working with if I'm a parent and I'm working I'm married. So we should both be coming from the parent state. In a good marriage, all day, most of the time we're coming from the same state, whether it's adult or parent, same place, and we're having a really good complementary transaction. However, so if I am working if I'm the parent stage and the person, my significant other, is at the child stage, that's okay for half a minute, right? If they're sick or something's going on, I'll take care of them. We're good with that. However, if this is a constant thing, I'm not okay with that. I do not want to be the adult and the other one be a child in a healthy relationship. So that's a cross transaction. Okay. And he did write the games people play, and it has to do with the communication process. So we look at how we talk to each other and on our inside kind of what state we're in as we're talking to someone else. Okay. So then he did a lot of work on that nonverbal communication also. So there's complementary transactions. That's when we come from the same ego state. And there are cross transactions where we're not at the same page. Okay. So things like strokes also. A stroke is a fundamental unit of social action. Is a stroke a unit of recognition? Everybody likes strokes. You know, give me some high five. Give me some what's going on. Like, you got this, girl. We all need strokes. So Eric Berne, TA. And yes, the games people play, what we play, have to do with what ego state that we're in. And, you know, perhaps that you're in a relationship where your significant other is trying not to, doesn't want to let go of the relationship. So he would be constantly coming from a child state because he knows you'll come from the parent state. Okay, so TA, Transactional Analysis, Eric Berne. Okay, so I just want to go back and review a couple of things. We've gone over a lot of my theorists today. Closing out some windows here. Okay, sorry, that's going to close the windows. It was getting, I teach all day, and my desktop looks like the inside of my head, which is scary. Questions, anybody? So in general, we've talked about Gestalt. We've talked about Eric Berne and TA. We've talked about reality therapy. We've talked about, what else? Carl Rogers, client-centered therapy. We talked about TA. Okay, so the goal is to kind of, again, let you listen to the ideas. Oh, we talked about Ann Rowe. We did. And she's a career person. We threw her in. Thank you very much. They're not the only theorists. I'm going to pull up some more. Those are the biggies we've talked about. But we'll go over a couple of more. Because, again, so now what we're looking at is not only do you have to know the theorists to really know how to answer the questions, because they're going to give you the key words of kind of what to do. And we didn't cover, some of these are not our family theorists, so like structural strategic systems approach, we haven't covered those. And I probably won't get to those today, so I'll have to pick up those at a different time. But we're going to try to cover all of these, at least my individual people. And for those of you who are taking the test with the new test, I'm sorry, research didn't go away. It's not going to go away. It looks the same as it did before. Sorry. There's a couple of things. And there's a diagram that what I will sometimes show, and there's also one in the Rosenthal book, the diagram that I definitely think you should memorize. That's just a way really to get some of those T-scores, Z-scores, and what that really looks like. I do. I go over different material each week. And if you haven't looked, if you go to YouTube and just Google Academic Coaching for World Changers, you'll see past group videos. So this one will be on YouTube probably in about 2 weeks, 3 weeks. But there's plenty from the last sessions if you want to go and look. This one will be available. You tell me if you want what we're working on. I'll gladly give you this. And when I talk about research, I will gladly give you what I'm working on that week. I have no concerns with that. Okay. So let's see here. We did that one. 45. Rogers has noted the second half of therapy usually creates more unhappiness and depression for clients than the first half. It is likely this may be attributed to what? What do you think this is, guys? So, one of the things that, as we especially get into the questions that are meatier, one of the things that are really always it's important to understand is there are 4 questions. So, 4 responses to the question. So, when you read the question, the first thing you're going to do is take away 2 that don't make any sense. None at all. They make no sense. It cannot possibly be it. If you can't find 2, just take away 1. Okay, so these are very either concept questions we're looking at, which are still very much a recall. When it comes to the ones application, you really want to make sure that you've, again, ruled out 2 that it can't be. You've got the 2 answers left that are very close. You're going to go back to the question and show me in the question why that's true. So especially in the vignettes, you'll find that to be quite helpful. Okay, you're going to really look for words, the same words that they've used or similar words that they've used in the vignette that are in the other answer stems. Okay, and yes, so more intensely working through the issues which have been identified. So that is correct for number 45. Oh, we did this one too. 46. In narrative therapy, the client often talks about problem-saturated story. Some specific counseling techniques that may be used in this therapy include all of the following except. So, narrative therapy is changing my story, changing the tapes inside my head that I keep telling myself over and over again. Okay? So that is correct. It's the miracle question because that belongs to who? Solution focus, brief therapy. '47. The family system approach, which generates the views that the family as an emotional unit and stresses the importance of more than one generation, is, if you ever did a genogram in college, this is the person you can thank. That is Bowen. He did. So Bowen is one of my theorists that has, so he's a systems approach. So he has lots of terms that we want to learn when it comes to Bowen. He believed in like differentiation. Enmeshment, you got it, you got it. So you might see enmeshment sometimes as diffused or fused relationships. So again, Murray Bowen. Okay. So what he said is that undifferentiated family ego mass, that oneness, we're stuck together. If you live in a family, especially talk about multi-generational families, so many times all we do is follow what grandmama and them did because they did it. They did it and we've continued to follow. So what he suggests is that we begin to differentiate ourselves and not necessarily, leave your family, but come up with a way to kind of figure out who you are separate from your family. Okay, and those are the words: fusion and the differentiation of self. Fusion is the lowest level. Fusion is enmeshment. Fusion is when you can't tell where I stop and you begin, or we're just so close. And I ask a kid, or why they do this because my grandma told my mom, and that's what we did. So that would explain the theories of the continual generational of having a kid when you're 15. That those are all part of that things we pass down, and they're generational patterns. Not that we say to the kid, this is what's going to happen, but those patterns keep continuing. Triangulation, what you just said. So triangulation, Miriam, you're going to be brave and try that one? It's right there in front of you. You just got to read it. So she's working on triangles. Marriage. Okay, so triangles are when we look at the activity, a major influence on the activities. The triangle is anxiety, more depressed, etc. So triangulation is we create these relationships between mom and kid, or kid and dad. So most often what we'll see in triangulation is, mom and dad are arguing, and someone will bring kid in. You were there when your mom did this, right? You were there. You were there. Tell her what happened. So that diffuses the tension that's between the husband and the wife by bringing in that third person. So whether that is the child, the mother-in-law, then someone next door, that's what triangulation looks like. Those are my triangles. Okay. Let's see here. Some other things you need to know. Family projection process. Parents should admit their lack of differentiation to their children. So what they said, so in a multi-generational family, then what happens is we continue those same patterns. And I'll gladly share. So I grew up in a very enmeshed family. We lived on family property. So my grandmother had 6 kids, and she had 7 kids, 4 boys and 2 girls. And everybody lived within walking distance of each other. We were very enmeshed. And yes, this is recorded, but I'll share. When I was 13 and started my period, before we could go any place to get any products, my mother had called all of her sisters, including my grandmother. So there was no clear differentiation between like where our family began and where my mother's family of origin as opposed to her family of creation. There was no. My father, when they got married, my father moved on to the family property. It was probably not a good idea. I'm not sure why someone didn't tell him that. But it really was just very close. And if you know anything about African-American families, and especially for the test, culturally, grandma's in charge. So, my grandmother was in charge. She ran things. She told my dad what to do. Probably that's why the marriage didn't work out very well. But that's what happens. So those things you just continue to do. You just continue to do because everyone else had done them in the family. So you don't even question of what you do on the holidays. You do whatever your mother did, whatever your grandmother did. We continue those patterns. Okay. And again, multi-generational progress. It can be anxiety, it can be patterns, it can be roles, things that we just continue to pass down. Emotional cutoff, that's a term you'll see that belongs to Bowen. A way to manage intense fusion and anxiety. Distance ourselves physically and emotionally, just escape. So according to my family, I'm the worst one in the world because I went away to college. And no one else had gone away to college. They'd gone to college, but they had stayed home. And I needed to figure out who I was. And for me, especially in this time, my mother had died. My mother died when I was a kid. So imagine from a totally enmeshed family and my mother dying. So in my family's eyes, that meant my aunts and my uncles and my grandmother all took care of me. And it was just a very, very enmeshed. We come from a big family. Wow. We come from a big family, and part of that family really talks about just the importance of family. Okay. So then, great fusion equals a greater cutoff. So the closer the family is, the harder it is to cut off. But if you don't, those patterns remain the same. Okay. The therapist is not a problem solver. The goals of therapy is to do that assessment. That's what the genogram is for. You process questions, detriangulation, break those triangles, taking I positions as opposed to the family feels, and displacement stories. Really talking about, how all of your stories don't necessarily have to match what the whole family did. Okay, so that was Bowen. If you had to do a genogram your whole life, you can blame him. Okay. Number 50, some counselors develop a personal theory for counseling based on their world views, educational, and experiences. They choose these techniques and processes from other theories which fit their own personal theory. It is called multimodal therapy, integrative counseling, cognitive or behavioral counseling, or individual psychotherapy. You got it. So integrative therapy is different than eclectic therapy. How? An integrative approach is I have a base already. I develop a personal theory for counseling based on who I am, and then I choose techniques from other theorists. So I have a base of where I'm coming from. I know who I am, and I like my base, but I'm going to bring in other theorists when I need to. Eclectic is someone who doesn't have their own base. It's just really someone who, no, multimodal is Lazarus, and that would be basic ID. Does that ring a bell? So eclectic is I have no theories of my own whatsoever. I'm just going to bring somebody else's in, and I'm going to take a part of everybody. Eclectic is I have nothing of my own, and I'm bringing everything in. And then integrative is I have a base already of what I believe, but I'll bring this in based on what I need. And you just said multimodal, and that belongs to Lazarus. Okay. And what Lazarus said was, yes, eclectic, you don't have any base of your own. You're always using different approaches, different orientations, which is either way, they're not bad or good, but eclectic, I don't have my own base. If I'm a behaviorist and I normally practice by the behavioral techniques, and my new client comes in and she needs more of a different approach, then I'm integrative. I'm going to integrate my behavioral techniques, but this one needs some warm fuzzies. So I may do different but I come from a behavioral background. So that is eclectic. Eclectic is I have none of my own. Integrative is I'm integrating some new stuff in my belief system, how I do my orientation, and then behavioral is of then where I'm going. But Lazarus was my basic ID. Yeah, of course you could. Of course you could. You could use CBT with all you, yes. But so many of so a lot of my students come from a very different base point. I have a student now, he's very much psychodynamic. He's in practice, trying to get his license, but he comes from a psychodynamic or psychoanalytic approach. He will add in a behavioral approach if he finds that needs to happen with this particular client. That's what makes him integrative, because overall, he's looking for the underlying things. He's trying to give insight. Overall, that is his approach. However, he'll add different behavior, different orientations based on what that client needs. Okay? So if you're eclectic, I don't have a base. I don't have a place that I normally practice from. I'm going to use whatever orientation works best for me. Okay? And so that's what Lazarus said. He said the multimodal is, we don't have to pick just one. He said overall, multimodal therapy would fit into what is known as a cognitive behavior form of treatment, which attends all modalities in human functioning. So what he said is that, if we look at the basic ID, the behavior, the effect, sensation, imagery, cognition, interpersonal and drugs, and the biology, their history, if we use that approach, then we'd be able to really kind of help the clients get where they need to be based on where they're coming from. And that is the basic ID, and that's a Lazarus approach. Okay, 51. There are many techniques in family counseling used by different therapists to examine the relationship between and among family members. One of these techniques asks a member of the family ask a member of the family among other family members, one of the members of the family to place other family members in a physical arrangement representing the relationship between two family members. This technique is called what? That is sculpting, exactly. And it really is kind of, you're asking the family, so what happened? Where was dad when this was going on? Where was mom when this was going on? Where was the brother? And you're actually putting the people in that relationship. Sometimes you'll see it looks, the vignette might say the mother is very much the mother never takes part of the family. She's never around. And when you sculpt those things, she'll put mother in the background. Or if the client feels that dad chooses a sibling over her, then and when she's sculpting, she'll definitely put the dad closer to the sibling, and she would be in the back because that demonstrates how she feels about herself and the family. Okay. Okay, I got to wrap it up tonight, guys. We covered a lot of those basic theorists. If I will put this link to this book, it's my Google Drive. You are more than welcome to. I will just put that link there. It's in my thing. So again, if you, I don't know what next week's topic is. I do apologize. I pace them like a month ahead of time. But so definitely if you want to join again next week, if you tutor with me individually, there's no additional charge. If you don't, then that's a regular charge for the group. But I will give you, so if you go to YouTube, I'll put that in there. If you go to YouTube, and if you search academic coaching for world changers, you can find some videos I've done as well as some of the old groups. It's on my Facebook page, Ellen. I will, my Facebook is Academic Coaching for World Changers. So if you're not on that, so again, I do teach for, I tutor for many exams. So when you're going on, if you look for academic coaching on YouTube, you just want to make sure that you follow the NCE ones. If it doesn't designate which one it's for, then many times just a content video that works for both. The main difference between your test and some of the other ones that I tutor for is your test is a lot higher in Theorists. So when it comes to like the NHCME, the national, that test, that was a huge vignette. We do work focus on diagnostic and more than all those other things. But in general, the big difference with this test is there's just a lot of making sure you know the theorists, whether it's these theorists or the career theorists. There's a lot of names on there. So if you're not tutoring with me and you're just doing my weekly groups, break it down. Just do not try to cover it all at once. Break it down in pieces. That's called partialization. Break it down, break it down, break it down. Learn a piece at a time. Go back. Learn another piece. Keep adding on. And in general, when it comes to answering those questions, really you're going to, there's two that make no sense. And if you've taken the test before, you'll get down to the two that are close. And then when the two that are close, go back to the question and prove it. Look for the words in the question. This theory is based on, I did teach people who English was not their first language, on how to pass like the ACT and the SAT, those really high verbiage tests that don't have, that you really kind of have to have some knowledge. And if English is not your first language, many times all of those words are difficult, not just the content, but the just general question. So what we taught is to kind of go back and just match the words. Look for something that matches or something that's synonymous and read around it. Okay, so the answer is in the stem. We've taught the other test this way for a very long time. The stem is the part of the question where the question is. So go back to the stem and then prove to me in the stem why it's this answer. That way it takes out your own stuff. Because if you've been in practice more than 5 minutes, you got stuff because that's what you've practiced. And this test comes from people who have not practiced what the book says, and you've got to just base it on that. So go back to the question, prove your answer in the question. Okay? Questions?
So Dr. Turner, basically, since the new revised, I guess, test, the way you want to say, for March on, the content and everything is still the same?
It is. It's just how the questions are asked. That's the only thing that's different.
Okay, so nothing is
No,
changed.
I'm sorry.
Or-
Still
or added.
research. Still, it didn't
Okay.
go away. I'm sorry.
Okay.
I'm so sorry. And again, next week, I do have a student who will be here. Probably one or two that will be here that passed this week. I'm going to kind of give you what they're really what it was like the test like for them. And again, if you've taken the test more than once, you will know the second test may be totally different. So you can't just study the information that you missed, because if you do that, then you're missing the rest of the stuff. Okay. Bye, guys. I'll see you this week or maybe next week in group. And this video, again, will be in this chat group. Go back. Feel free. It'll be in this chat group here for 30 days. And at some point down the road, it will be on YouTube. Bye.